Health, your weekly dose of health and wealth information on KUTV.
Epilepsy is a brain disorder that causes seizures. But how often do you make the assumption that it is associated with witchcraft? What are some of the myths and misconceptions of epilepsy? Join me, Boari Michelle, on Focus on Health as we demystify epilepsy. But even before we see Daktari on that, here now is the health update. Our topic today is epilepsy, which is associated with a lot of stigma, and most people would prefer to actually shun away from the conversation. Thank you so much for tuning in today and join us through this conversation, even through our social media platforms at KUTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram. Make sure you hit us up with all your comments, suggestions, and any queries. Joining us for this conversation is Daktari. Thank you so much, Daktari, for joining us today. It's a pleasure having you here today. So, Daktari, even before we head down to our topic today, kindly introduce yourself to our viewers.
Thank you, Michelle, for this opportunity you're giving us to teach the Kenyans. My name is Dr. Gilbert Menyoki. I'm a physician and a consultant neurologist, currently teaching Kenyatta University School of Medicine. Thank you.
Maybe you could define to us what exactly is epilepsy, because it's a conversation that most people would rather not have in the society.
Thank you, Michelle. It's true what you said. Epilepsy is really very much misunderstood, a lot of myth and stigma. But epilepsy is very simple. Epilepsy simply says, normally the brain works with the normal organized electrical activity for you to think and do all that. However, sometimes the brain goes into paroxysmal electrical activity discharge abnormally. So usually in that control, then you lose either your consciousness or abnormal movement or whatever. So usually with one kind of a seizure, which is now that disorganized electrical discharge, you get it a seizure. When they start recurring, or two in a year, then you call them epilepsy. So epilepsy is really a recurrent events of seizures, and we define two of them in a year. We call it epilepsy.
So, Dr. you mean that there's a distinction between epilepsy and a seizure, and that when you have one, it's not epilepsy. When you have more, that's when it becomes epilepsy?
Excellent. Because when you have only one single seizure, then that's not epilepsy, and you don't even think of treating unless in certain conditions. So most of the time is when it repeats and is recurrent and is untriggered, that when you call it epilepsy.
Thank you so much for your feedback. We appreciate all the comments, all the suggestions, and all the queries. Daktari is going to continue guiding us on epilepsy and demystify it further for us. So, Daktari, maybe you could now proceed to the causes. What exactly causes epilepsy?
Thank you, Michelle. That's a very good, excellent question. Excellent, because many people seem to attach epilepsy with myth, spirits, witchcraft. But epilepsy has several causes. Of course, it depends on age group. The early age group, we tend to have things to do with either birth, asphyxia, or infection, or developmental causes. The common epilepsy in the ages of 12 to 20s tend to be, over half of them, we call it idiopathic, we will not find a cause. So most of that time, there seems to be some genetic factors, which gene differences which predispose you to get epilepsy. So they are mainly idiopathic, we never find, but we propose or we think it's more of gene problems. But again, remember there are other causes, like you could have brain trauma, could have those who have had a stroke events, those who have got an infection, and in age groups of 6 to 12, you could have those who have gotten febrile seizures. So there are many varied causes, but generally many we may not find a cause. The reason people seem to attach a lot of myth with epilepsy.
Doctor, is epilepsy common in the country, and does it affect specific gender?
Again, a very good question. Epilepsy generally is common, okay? Because we usually say you have, in every 1,000 people, you'll find 5 people with epilepsy. And if you are to put 100,000 people, follow them in a year, you find 20 to 70 of them will go and develop epilepsy. So generally common. We have done several studies in Kenya, and it looks like even our numbers, the numbers we mentioned are more developed country. In our setup, the numbers are even higher. Okay, so epilepsy is common and is even more common in our country, and a lot can be done about it.
Dr. Let's talk about the signs and symptoms of epilepsy. How exactly does it manifest itself?
Good, excellent. Epilepsy is, in terms of symptoms and signs, are very diverse. Really, the symptoms and signs are very diverse, and the types of epilepsy. So they are dependent more on the types of seizures you are getting. Okay, and generally when we talk about seizures and types, we will have what we call, I'm trying to draw a brain in a very crude way, and essentially all I'm saying, this is your brain. Assume this is a focal area and this is the central part of your brain. Okay, now the common types of seizure tends to be generalized seizures, and they usually control the brain by generating electrical activity which control the whole of the brain. In this case, most of the people will present with loss of consciousness. Okay, so they will not know themselves. Then they go, the common type of seizure which is known is the grand mal, where they will go into tonic-clonic movement. Most of the time they tend to tonic and they crash down, and then they go into clonic movement. So that is the general common one. But remember, there are other rarely understood in the normal Kenyan or Kenyan person, which we call focal. The electrical abnormal activity starts at a focal area, and this could be the focal area which controls the hand, for example. And so they will have just epilepsy, which is focal, by purely just a twitching of the hand, with a twitching of the hand. And subsequently, as it generalizes to other, then it goes to like you're dancing. The hand completely goes before now you get yourself loss of consciousness and others. Then that is focal. Remember, you can have others which are complex, and these ones will either start with just abnormal behavior. Munyoki is standing, for example, and I just start fibbling. I lose myself, we are not talking, and I start just bubbling my hand before maybe I crash down. So generally different symptoms, different depending on the type. Others may just feel like deja vu. I feel like in a different world, a different place, and different people, just suddenly, and then I'm back. So symptoms differ, and they are varied. Okay, yes, depending on the type of seizure, so to say.
Guided us through the focal seizure and the general seizure. Do we have one that is more severe than the other?
Let's say, in terms of the, we wouldn't call it severity, but I would say it's more on, is it the ones which tends to be more easily visible, easily understood, is the grand mal seizures. Okay, and this is the one I've said. This is the typical one which associates, like you lose consciousness, you fall, and then you go into a tonic-clonic movement. So that is generally, you would say, tends to be common because it's the one, even in studies, we tend to pick easily as opposed to the minor ones or simple ones, which they are not easily picked by non-doctors. Yeah.
You mentioned something about the chronic movements. Does one feel pain during these movements, or would it even result to one injuring oneself?
Thank you, Michelle. Yes, grand mal, the danger of grand mal, as we are going to be talking maybe about treatment, is the injury to the self. Remember, the first thing for that one is you lose consciousness. You have no control yourself. So wherever you are, you hold your breath and you land. If there is a stone or fire or water, whatever is available there, you land on it. So you are at risk of injuring yourself, especially with what we will call the common grand mal. So an injury to yourself. Of course, notice again, you could have some which have psychiatric behavior and you could easily injure others. Okay, so yes, could be a danger to yourself and injury to even others.
Approximately how long do these seizures last, Daktari?
And no more, well, a standard, by definition, we say most of them seizures will take 5 minutes. Okay, and even when that seizure continues more than 5 minutes, we actually classify the status epilepticus. It becomes a little more risk. Or even when you get 5 minutes, then in another you don't get your conscious back, you get another one, again that becomes status. That requires urgent attention. So normally it's 5 minutes, but if it's taking more, then you need more urgent attention to that seizure.
Daktari, maybe now you could take us through the diagnosis of epilepsy. How do you go about it?
Epilepsy is it's usually a diagnosis of epilepsy is really a clinical diagnostic most of the time. Okay, it is mainly dependent on the patient describing, and most of the time we usually say a rule of, for you to make a good diagnosis of epilepsy, always have the patient accompanied by an observer, because the clinical description is really what makes you make a diagnosis of epilepsy in most of the time, 80%. Of course, we have diagnostic testing, which we tend to do to confirm. Okay, most of the time is actually to rule a possibility of other causes of epilepsy or seizures as opposed to epilepsy. Okay, so in terms of diagnostic, when you see the patient, first of all, with the seizure, you think it could be other causes. Other causes could be, I've just had a seizure, like you've been sitting for long and you just faint. So most of the time you need to find what is that. Okay, so you do testing, trying to look at those basic blood sugar, you do ECGs before you even do EEG, because the assumption is the fungal, just fall because of syncope is more common, because of heart problem is more common. Before now you start doing imaging of the brain to see whether there could be an abnormality in the brain or a growth in the brain, and many other investigations. But the key is a good history. The patient coming, explaining to you what they are undergoing, and a relative or a friend accompanying them to describe to you what they observed. That makes them better diagnostic of that.
So Daktari, hold on to that thought. We're going to take a slight commercial break. When we come back, Daktari is going to be guiding us more on diagnosis and treatment of epilepsy. Make sure you continue tweeting, you continue texting us with all your comments and suggestions on our social media platforms, and we'll get back to you as we continue with the discussion on epilepsy. But first, here now is the Did You Know segment.